everyone, and welcome back to the series 5 in 5. This is where I share with you 5 key clinical tips in 5 minutes or less. If you're new, then a massive welcome to you. My name is Dr. Baptiste. I work as a portfolio GP. And if you are new and you haven't subscribed, then why not have a look around my channel? I'm sure you'll find something that will suit your needs. I'm sure you'll find something that will help you on your medical career journey. As always, if you enjoyed the video, then make sure you give it a thumbs up. Let's get into the video. Today's video is going to be about useful tools that you can use not only in general practice, but in your consultations with patients. So let's get into it. So the first couple of tools or measurements are questionnaires, patient questionnaires that you can give to patients to help really understand what is going on. First questionnaire I'm going to talk about is the patient health questionnaire, or PHQ-9, and the second one is the GAD or GAD, or generalized anxiety disorder 7. So these, like I said, can be used to understand what's going on. Does the patient have a mental health illness? Are they suffering with depression? Are they suffering with anxiety? Or are they suffering with both, which of course can occur? And the measurements also tell us how severe the condition is. So does the patient need counseling? Do they need intensive therapy? Do they need medications? Do they need both? Do they need an urgent referral to the mental health team? Do they need to go to A&E? So I really like using these questionnaires. I don't use them all the time, but when I do use them, they are really good, because when the patient comes to see me again, if they do for a follow-up, I can look at that questionnaire and I can see how they were at the last consultation. Of course, I ask them questions without the questionnaire, but I think it's really good to have a tool like this so that you can see, exactly at that time the score and what their responses were, because things do change, and sometimes people aren't always that good at verbalizing how they feel or verbalizing their emotions. So using something like this is really good. And the next time I see the patient, like I said, for a follow-up, for example, I'll ask them to do the questionnaire again, and then you can see, are they getting better? Are they getting worse? And if they're getting worse, what can you do to help them? Use these tools as a way to kind of track the patient's progress, and it's also good for them as well, and then they can see how far they may have come in terms of their recovery. Next couple of tools I'm going to be talking you through are CENTOR criteria and fever pain scores. These are used if you're assessing someone who has a sore throat, and basically it helps you determine whether or not they may need antibiotics. I will leave some links in the description box below for you to have a look at. It's felt that the fever pain score is better than the CENTOR criteria based on a study, and I will leave a link to that information in the description box below. I did use the CENTOR criteria, but that has basically been replaced by the fever pain score that I use now. You don't have to use it all the time, but it definitely does help you with consultations. And like you can see, if you do look at the scores, they do help you determine the likelihood of this being a bacterial infection, and then if you should give antibiotics. You can even give a delayed prescription of antibiotics. The patient may be able to take to the pharmacy or collect from the pharmacy in 24 to 48 hours. So it does really help you, and it also helps you explain your reasoning and your rationale to your patients. So those were a few tools that I use every day. There are many more tools, and I can do another video on those tools if you'd like me to, so let me know in the comment section below. As always, if you enjoyed the video, then make sure you give it a thumbs up and subscribe if you haven't already. I will see you in my next video.